Columbia Medical College for giving me this great opportunity to the first session of this August conference, and my sincere gratitude to Dr. Satish for the kind introductory words. So the topic is being humane, teaching empathy, ethics and professional identity formation in the age of artificial intelligence. You know, the age of artificial intelligence is the age of information overload, deep fake and so much of confusion. So how are we going to guide an extremely empowered medical student who is much more knowledgeable or exposed to much more knowledge and information in the present era happens to be topic of my presentation. So the first and foremost thing we should understand is that, as per a study conducted by the Indian Medical Association, the doctors of India expire at least a decade earlier than the patients who they treat. That is the reality. So if we go and analyze the reasons behind that, we have to go back to so many research studies which have happened all over the world, starting from the celebrated Harvard Human Development Study or GRANT study, which gives us some insights regarding how a person should go forward in life, what should be the priorities in life. In fact, among the different taglines of this conference, I was extremely impressed by the particular statement, real world readiness and wellness, because that is probably the first and foremost, the most important core skill which we have to instill in the minds of the budding medical professionals. The Harvard Human Development Study, which started way back in 1938, it was done on students who came to Harvard from different continents of the world to pursue their education in different fields. The study which is still continuing, more than 86 years old, more than 30,000 people have participated in the study, the largest and longest study on human development undertaken anywhere in the world, gives us a couple of very important insights. Number one, super intelligent people with an IQ of above 140. When we compare them with people with average intelligence with an IQ between 100 to 110, who are likely to become more successful in life? So success can be defined in different terms, but if we use monetary gains and financial gains to define success, even then, the people with average intelligence, 100 to 110 IQ, earn $150,000 more than the super intelligent personalities. Insight number two is that among the 5 factors which enhance the lifespan of a human being, apart from regular exercise, healthy diet, staying away from alcohol and abstaining from all kinds of tobacco products, the most important factor is the 5th one. It is the factor which enhances the lifespan of a human being to the maximum. That is the quality of human relationships, especially those established during childhood and adolescence. So this points to certain very important aspects which we have to instill in the minds of a young medical student if he is supposed to live a long life, a healthy life, and a productive life. So we talk about empathy. What is empathy? We have been talking about empathy to the students right from very early days itself. It is the state of mind in which you place yourself in another person's shoes, internalize and understand the realities of these emotions, and react accordingly. Of course, how can we teach empathy? Can we teach a human being to be more humane? Of course, the biggest discovery in neurosciences in the 21st century happens to be the concept of mirror neurons developed by Giacomo Michelletti. So mirror neurons are a group of neurons located in different parts of the brain, ranging from the prefrontal cortex to different areas. It is a neurobiological basis of what we call empathy. Certain people are born with very powerful mirror neuron network. Certain others develop these networks over the years as a result of training. Different forms of training is available. And a small proportion of the society, despite being given proper training, they don't develop these kind of networks in the brain as well. So here, the modern world proves to us that more than academic intelligence, it is the emotional intelligence, the social intelligence, and ecological intelligence of a doctor which distinguishes him from another person. It is these 3 skills which make a doctor a real great soul in this profession. So how to train our students in these three aspects happens to be the first and foremost challenge. Of course, we have to teach them empathy, and apart from empathy, there is something called advanced empathy also, which is better. What is this advanced empathy? Can anybody in this group please volunteer to answer what is advanced empathy? Anyone? Often when a patient is coming and sitting in front of us, he or she may not verbalize or vocalize the realities of his life. But from the body language, from the eye contact, from the gestures, from the postures, we have to understand what could be probably going on in the life of this person. Imagine a lady who is presenting to the OP with a back pain. Associate is coming along with her husband. We are asking her, is there anything wrong at your house? She says that no, my family is perfect. But the modulation of her voice, the eye contact she is maintaining with you, the facial expression very clearly shows that she could be a victim of domestic violence potentially. So this ability to understand the emotions of a person from the non-verbal cues which he or she is sharing and vocalizing it appropriately and intervening appropriately, that happens to be what is called advanced empathy, which is very important for a budding medical professional. And of course, the last two things are also very important. A doctor has to be compassionate, and more importantly, there should be something called self-compassion. What is meant by self-compassion? If you just Google get science, see hundreds of research papers being published about self-compassion to medical professionals and how it is going to positively impact their work. So self-compassion is an attitude in which you are kind to yourself. You take yourself in a very kind manner. You don't exert too much for the sake of the world or your profession. You are kind towards yourself. You take care of yourself. It's essentially an advanced form of self-care also. So let us come to the next important thing, ethics. So when we teach ethics to medical students, the first and foremost thing which we should communicate to them is they should have a sense of history about their specialty. When I address the first year medical students in my college, the first question I ask them is, which branch of medicine you are pursuing? Is it Ayurveda? Is it allopathy? Is it homeopathy? Is it naturopathy? Which pati you are studying? And most often, most of our students say that we are trying to get a degree in allopathy. How many of you agree? How many allopathic graduates are there in this hall? Please raise your hands. One of your allopathic graduates. So again here we go back to history. Who coined the term allopathy? So that's very rightly answered. It is Dr. Samuel Hahnemann who coined the term allopathy. And it is a term with very strong derogatory connotations attached to it. So homeopathy means something which comes from inside, which is desirable, which is healthier. Allopathy is something which comes from outside, which is likely to be toxic, undesirable, which should be kept at a distance. Still, do you want to wear that crown on your head? Are any allopathic doctors in this hall remaining right now? So this is how we may have to teach them the history of what you call evidence-based modern medicine, as we call our specialty. So it is evidence-based modern medicine and not allopathy. Of course, allopathy is a term which is very commonly used in everyday parlance, but it is a term with very strong derogatory connotations. So how did our subject evolve over the last few generations, over the last few centuries? What makes medical science a real science and not a religion? And how medical science has evolved, how medical science has identified its previous mistakes, rectified, and continued its scientific temperament in the journey forward. So this sense of history is extremely important when we train and teach a medical graduate, because unless he is very clear about the history of this specialty, he is never going to value the course he is pursuing, is never going to address the real value of the subject he is studying. So here again, ethics is something which we all teach our students. The 4 pillars of medical ethics, as we call the autonomy, justice, beneficence and non-maleficence, which I need not elaborate in detail. But in modern terms, especially in corporate medical sector, such a reality is prevalent. What is this medical jousting? Medical jousting is it? You see the prescription of a doctor and in front of the patient you say, which is prescription. Or even if you don't verbalize or vocalize that, the facial expression, and this facial expression will clearly express your disgust. And the poor patient thinks that the previous doctor who treated him or her is an idiot. So this is something which is creeping into the behavior of doctors right now. And corporate culture is breathing it like it enhances this kind of a jousting culture. This is the second foremost thing which we have to teach our students if they have to become trained. Avoid medical jousting at any cost. Medical jousting is a phenomenon in which a doctor criticizes either verbally or non-verbally the line of management which was initiated by another consultant for the same patient in the past. So here again, this first terminology which is given in the slide, the curse of super specialization. It's a reality in modern medicine because when they go and see a homeopathic consultant or an Ayurvedic doctor or a naturopathy healer, they take into account the various aspects of the life of the patient, not just the back pain he is having. They'll ask about the history of his personal life, the relationship with his family members, any emotional issues he has gone through, and a sort of a holistic approach within the limitations of the branch they list. But here what happens if we go to a big super specialty hospital with a back pain is that the orthopedic surgeon will evaluate for the bones and then he will say that now we have to check the nerves, we have to go to the neurologist. The neurologist after the evaluation will say you have to go to the physical medicine and rehabilitation consultant for the next step of the management. And maybe the PMR consultant will say that there seems to be a functional element in this, you have to go and meet a psychiatrist. So this experience of touring different specialities, and the patient becomes better by the time it is evening. Is any doctor in this hospital capable of treating me as a human being? That is the doubt which they have in their mind. So we have got multidisciplinary approach in modern medicine where specialities, consultants from different specialities, they do their role in treating the problem of the patient. But of course, COVID has taught us that we need to develop this transdisciplinary approach also. Maybe during COVID, people with advanced dementia and behavioral problems who used to come to me for behavioral problems and maybe to a neurologist for the cognitive aspects of the problem. They used to come to just me because behavioral problem was the most compelling thing. I used to discuss with my neurologist friend and prescribe what was necessary for the cognitive functions also. So a person with diabetes who is having depression will go to my diabetologist friend. He's on antidepressants. He used to call me and ask me, what should I do? This antidepressant is there. So she has been suffering from hyponatremia of late. Now I ask him whether he is on any selective serotonin reuptake inhibitors. They say yes, he is on sertraline. Sertraline is an excellent drug which can prevent the emergence of myocardial infarction in a person with diabetes or metabolic syndrome, but in elderly it can produce hyponatremia. So I ask him, please remove sertraline, substitute it with another antidepressant. This used to be the transdisciplinary approach. Maybe in the present world, the concept of family physician is returning. So we need to instill the sense of transdisciplinary approach of practice of medicine also in the minds of the present day transplants. And finally, the art of avoiding litigation, because things are progressing in such a way, and just like in many foreign countries, litigation is becoming the reality in modern medicine. So how to protect oneself from litigation, how to meticulously document things, how to prevent any kind of miscommunication, because recently a big psychiatric hospital in Calicut, they received a complaint which was forwarded by the mental health review board They gave a reply to that, but the Mental Health Review Board was not satisfied with the reply. They forwarded the complaint to the court, and the court has charged a case. Simple issue is that the patient was admitted in a state of catatonia, and the consultant there planned to conduct electroconvulsive therapy. It was communicated to the relative who signed the consent, but when the patient was inside the theatre for being subjected to ECG, at that moment precisely, the relative withdrew the consent for giving ECG. So ECG was not delivered, the patient was shifted back to the room without giving ECG. But unfortunately, the sister in the ward, the nursing staff in the ward, documented in the nursing record that patient shifted to ward after giving ECG. The relative just happened to just see this page in the nurse's record, took a photo of that and complained to the Mental Health Review Board that against my consent, the patient has been subject to ECG. So just a mismatch of documentation from the side of the doctor and the nursing staff. This has led to the litigation. So these are all avoidable situations. So how to communicate with each other, the team members of your treating team, not just the doctors, consultants from other specialties, the nursing staff, maybe the auxiliary staff also, because everybody should have a uniform opinion about how the treatment is proceeding, and no confusion should be there, and the way in which the message is communicated to the patient and bystanders, there should not be any room for ambiguity. That should be very clear. So here again, about the doctor-patient relationship in the modern era. Maybe 30 years ago, when we were school children, and maybe 20 years ago when we became medical students, the most prominent model in our part of the world, at least, was the paternalistic model, where the doctor was the only source of information. The doctor used to dictate terms, and the patient used to be extremely compliant, adherent, and obedient to the instructions given by the doctor. They never used to ask any doubt, because they will select only a doctor they trust explicitly. That was the paternalistic model. Still, once in a while, we get some patients who subscribe to the paternalistic model, and that's a joy for the treating doctor even today. Then we have got an informative model in which doctor is the source of information. He explains the diagnosis, explains the different therapeutic options, the pros and cons of each of them, the possibilities of success in each of those treatment options, and leaves the decision to the patient. The patient can pick and choose what he wants. Third is the interpretive model, where again the doctor explains the diagnosis, the treatment option, the pros and cons. And here again, the patient will ask the doctor probably, if a family member of yours had the same illness, which of these would you choose? Could you explain to me? The doctor has the role of a counselor. So in the second model, it is just an information provider. In the third model, the doctor is a counselor also. It gives a little bit edge for the doctor to impress upon the mind of the patient what he wants the patient to be treated with. And the fourth model, which is creeping in our big cities right now, the deliberative model. The doctor has to explain everything, then the patient goes home, asks for second opinion, third opinion, fourth opinion to different consultants in different specialties. Just takes the picture of the treatment records and WhatsApps it to a celebrated consultant in Canada and gets his opinion, asks Dr. Google, asks ChatGPT and DeepSeek and everybody, and gets multiple opinions, and comes back next day to confront the doctor in full-fledged form. And he'll ask, doctor, you never mentioned about the chelation therapy, which is a very celebrated therapeutic option for my condition. How dare you miss this wonderful treatment option? And of course, it becomes the job of the doctor to convince the patient, giving elaborate explanations why chelation is not the best treatment option for this condition at this point of time, considering the multitude of comorbidities the person has. It becomes very difficult. So, I remember my childhood, when my parents decided to send me to medicine. The only reason was that my communication skills were much below average. So my father used to say that the only field in which this idiot can survive is becoming a doctor, because he just has to prescribe some medicines. He need not talk to anybody. So that used to be the scenario maybe 20-25 years back. Cut to the present era where the doctor has to be impressively communicating to drive home this message to the patient. That is the challenge of the modern era. So we come to the third part of my talk, how to establish professional identity. How to ensure that the medical student you are training develops into a full-fledged professional. So professionalism is a term which is very clearly used in our day-to-day parlance. What does it mean to be a professional in medical profession? So my friend who is practicing as a psychiatrist in Australia tells me that there is no punching machine, no attendance register in this hospital. But everybody comes to the hospital at the dawn of 9 a.m., works till 5 p.m. and leaves only after every job is finished. If by any reason they are unable to turn up due to a medical issue, they entrust the responsibility to somebody else and ensure that the job is done very precisely. What about our part of the world? We have punching machines in almost all institutions. NMC is modifying the nature of the punching machine so that they can catch you live with your face so that you are in the campus and not hovering about in different places. So the problem here is that internal sense of discipline, which probably most of the Western societies have, is conspicuous by its absence in our culture. Because we feel that a person who doesn't come for a job at the right time, who just bunks classes and still arranges somebody else to call a proxy and gets his attendance and is capable of writing the exam, he becomes an instant celebrity among the students. Similar with the professionals also. The person who doesn't come to job at the right time or turns up fashionably late, does something, puts the brand on his colleagues and leaves early. We also think that why can't we also be like him? We are very much concerned about the liberty and freedom that the Western society is having, but we are unfortunately not bothered about the internal sense of discipline which they have, which make them a disciplined professional force in those countries. So that is one fundamental thing we have to instill in the minds of medical students. They have to be punctual, they have to come at the right time, do the job, not because somebody is pointing a gun at their head and asking them to do the job, because they enjoy the process of engaging in the job. That is something which we have to instill in the minds of the young professionals. So, the professional identity of a doctor, of course, if he treats patients, is a clinician. Every doctor is a teacher. The meaning of the word doctor itself is a teacher, because he teaches not just about the illness, but about wellness also, about health also, how to proactively modify your lifestyle so that you remain healthy for a long span of time. All these things he has to teach. And the third point I was just mentioning right now, people like me who never had communication skills ended up being doctors, but nowadays we need better communicators to come into the medical profession. And the fourth one, a doctor is an influencer. This is something which happens in the tech age, modern age. You have a lot of YouTube doctors in town, right? But spreading messages about anything and everything under the sun, including the sun, giving very categorical advices. The problem with the tech era is that the first information within Google need not be the most authentic information for that subject. Just happens to be the top or the information of the article which was seen by maximum number of people. I remember an instance during the first wave of COVID when a media person friend of mine came to my home and requested to record a video about how to manage domestic violence when husband and wife are staying together after a very long gap thanks to lockdown. So there was news that domestic violence was increasing. I just recorded a 30-minute video and he was very happy. He told me that he would upload it and send me the link. Within a couple of days, my school classmate from Dubai, he sent me the link of the video. And the title of the video was "Streegale Engane Vachigirikkan Pramukha Manoranam." And I was standing like this with a weird smile on my face. It just means, how to lure events. That was the title of the video when I translated it to English. So I just saw the video and there was nothing about how to lure females in that. The theme was how to avoid domestic violence, how to cooperate with each other, how to resolve interpersonal conflicts by just staying together. I called up the media person and asked him, how dare you put this title to this video? This is producing a lot of inconvenience to me. He told me, doctor, this video has touched 1 million views in less than 24 hours. So many of these YouTube doctors put these kind of very sensational titles like and these kind of videos, so that maximum people see those videos and they end up becoming experts in that field. So it is very important for the modern medical professionals to communicate to the public in the shortest possible form, whether it is reels or shorts or whatever it is, can do away with the social media, spreading authentic messages, correcting misconceptions. At the same time, not resorting to these kind of titillating stuff just to get more views or just to get more money from YouTube. Of course, we have to be researchers. Not being a researcher, just being a researcher is not enough. You have to communicate the findings of your research to the general public also. So what we have been trying right now is in Kerala Journal of Psychiatry, there was a study published about the impact of play in child development. So after that research article was published, we ourselves conducted so many programs for the media, print media, electronic media, all kinds of media where we discussed the findings of this research, especially during this summer vacation season, because the parents would be prompted to send their children to outdoor games so that can enhance the level of dopamine in their brain and increase their attention span and prevent them from getting addicted to gadgets and even drug addiction. So it is very important to do research and communicate the result of your research to the common man also. And of course, you need to be an advocate. Advocate of what? Advocate of your specialty. Advocate of the knowledge you are generating or learning. Advocate of the new skills you are understanding. And advocate of ethical practices in medicine. So here again, I'll just wind up my talk with this one topic, because wellness and real world readiness is one of the important themes of this conference. Every medical student should be trained in this one particular thing in the initial phase of this training itself, probably the foundation courses. What is a mental health first aid? You know, a couple of days ago, a medical student from a medical college in Kerala committed suicide, a first year student. Every year, we get to hear about suicides among postgraduates and undergraduates in medical profession, repeatedly. Still, we are unable to figure out what is the fundamental problem and how to go about it. And many of their friends tell them, this person was very cheerful till a couple of days ago. We never knew that he had a problem in the first place. So that is, this mental health first aid is probably the solution to that. Not only medical students, even medical teachers should be trained in mental health first aid. If we come across any person, be it our student or colleague or any person in our knowledge who is going through stress, we have to do these 5 things. If the person is not communicating like usual, proactively go to him and inquire what is troubling him. That's the first step. Approach the person and inquire. Because there is an influence of toxic masculinity in our culture, even though it's a Western concept. It is very much internalized in our culture as well. Because many of these adolescent boys, they don't talk about their stress because they think that it is a sign of weakness to talk about their stress, their emotional problems. We should correct that, because there are a lot of news in newspapers about how a 16-year-old boy fell down from the 10th floor apartment and died. How an 18-year-old boy died in a bike accident. How a 19-year-old boy got drowned in Goa on the beach. Many of these sound like accidents, but unfortunately, a large number of these events are suicides conveniently masqueraded as accidents. Because this toxic masculinity follows you to the grave even. Even at the point of your death, you want to picture your death in such a way that suicide is a sign of weakness, so if it's an accident, it's a sign of probably machoism and masculinity. It's a convenient thing for the person who commits suicide as well as the parents, because for the parents, if a knowledge comes that the child has committed suicide, the entire society will be making fun of them, criticizing them for faulty parenting. But if it is an accident which has happened, the sympathy of the entire society will be with the parents. So we need to explore these aspects also when we engage with children. Second step is to listen. Most of the students say that medical teachers have this compulsive habit of advising. The moment they hear something from the student, they start advising, trivializing the problems. We tell them, don't think that you are the only person who is going through these kind of stress. During our days, maybe 50 years ago, I never had any money in my pocket. I used to work part-time and then study and got distinction and gold medal during my undergraduate days. You should be inspired by my life. It doesn't work, unfortunately, like that. We should learn. So we should listen non-judgmentally, without interrupting, intruding, mocking, trivializing, or making fun of the person. So that is very important. So a non-judgmental listener is a very important aspect in medicine. Teacher as well as a student should be a non-judgmental listener, because we are likely to get so many stories from the part of the students which may not subscribe to our ethical and moral standards. Maybe pansexuality is very much known to the younger generation. I'm sure most of the teachers may not subscribe to that philosophy, but it's a reality. We need to accept them as they are. There's no way out. Third is give information and reassurance. If you think that it's a faulty thought process or wrong information which is stressing them up, give the right information. Maybe they are going through a personal trauma in which the father of the student is suffering from stage 4 lung cancer, is the deathbed. We cannot say that it doesn't matter. It matters a lot to that person. We can give a reassurance that within my limitations as a human being, I will be there of help to you as much as I can. That is reassurance. Even after these 3 steps, if problems remain, we go to the 4th step, that is encourage professional help. We can refer that child to Dr. Satish and ask for his expert intervention and help. Whether there is depression or anxiety or substance dependence or ADHD, that can be treated. And finally, the most important thing, again the lesson which we have learned from Harvard, encourage social support. Engage or ask the children to engage in community activities in which they work as a team. Because nowadays the younger generation is becoming socially disconnected because they don't need human connect to get happiness in life anymore. They can remain in the privacy of the room with a digital gadget and enjoy their life very much. So we have to encourage them to connect with each other, connect with different generations, because it is the quality of human relationships which is most important. So in AI era, the information overload, lack of critical thinking, lot of information is there, but which is right? No idea. Managing criticism, both online and offline, because many doctors are subjected to cyberbullying. If something goes wrong, a criticism happens, a controversy erupts at workplace, cyberbullying of very great magnitude, that is affecting the mental health of the doctors. We have to empower our children to face those things. And also, the era of deep fake where faulty information, misinformation, malicious information can spread about anybody. We need to be aware of this. So medical humanities is very important because experiential learning is very important in medical curriculum. So we have got attitude, ethics and communication module or the ATCOM module, where in first year we teach them what is it to be a doctor, what is it to be a patient, doctor-patient relationship and communication skills, apart from cadaver as the best teacher. The first 4 of these topics have got strong behavioral sciences foundation. It's a wonderful opportunity to integrate humanities to medical curriculum. And you don't need to be a behavioral science professional to do that. Any doctor, any medical professional with an interest and inclination for humanities can take this up. So one of the ways in which we have taught students this aspect of life is, we've asked them to read some books like Man's Search for Meaning by Dr. Viktor Frankl, who had remained in concentration camps during the Second World War and his turmoils which he had to face there. On Death and Dying by Elizabeth Kubler-Ross, which gives terrific insight about the emotional state of a person who is going through terminal illness and how you need to respond to that. And even a very recent on When Breath Becomes Air by Paul Kalanidhi, which portrays the life of a doctor from the other side of the table when he became a patient. So reading, understanding what is happening from both sides of the table, watching some movies also which can range from Patch Adams to Shawshank Redemption to anything of that sort. Even Rashomon by Akira Kurosawa could be an interesting movie because it will help the children understand that there could be different perspectives to the same issue. So teaching them in that way, that will help them to enjoy the process of learning very much. And phases of the life of a doctor, it starts from the stressful days of being a medical seat aspirant to different stages in the medical college, and finally the last stage, the stage of boredom, where you become fed up with what you're doing because it is so monotonous and repetitive. So this burnout is a reality. So to manage burnout, you need to teach the students to rediscover themselves, rediscover their passion, not only in profession, but extra professionally as well. Be creative, both in your profession and outside. Connect with people and explore more avenues of life. This is my last slide, the 10 commandments for a doctor, which probably we need to internalize ourselves and teach our students also. You should not expect someone else to take care of your stress. It is your responsibility to take care of your stress. Should not resist change because the next generation is going to be more intelligent than you. The Flynn effect is a reality. The younger generation has got better IQ than you. They will go forward however hard you try to prevent them. Third is, don't take yourself in vain. Self-care is very important. Understand what is important to you. Prioritize what are the important things in your life. Take care of your family. Take care of your hobbies. Spend time with your children, most important. Spend time with your spouse because a loved spouse is going to be a loving spouse. And if you don't love your spouse, you are in for great trouble in your life. Understand your limits because you are not a superhuman. The doctors should do away with this God complex. Whether conventionally, a generation ago, a doctor who used to work at midnight and not sleep was considered to be the greatest doctor in town. It doesn't work that way anymore. The modern life is extremely tiresome. You have to understand your limits, and you don't need to work that way also because there is no shortage of doctors in town anymore, anywhere in the world. Should not work alone. Teamwork is very important. How to recognize and realize the importance of every member in your team, whether it is nursing staff or auxiliary staff, how to recognize them, appreciate the job, how to reward them, and how to generate a sense of goodwill in their minds. It is very important. Should not kill yourself, should not kill others. Needless to say. Should not work hard, but work smart, because as you grow old, become more experienced, cut down the hours of your work, but increase the quality of your work and spend some time for things you love to do every day. Seek to find joy and mastery in work. Identify your niche area of expertise. Do some research, publish your research, write some books, do some talks and become the expert and master of that area than just being, a person who sees 250 patients every day till the end of your life. And finally, as NMC also very clearly says, you should be a lifelong learner. You'll get a chance to learn from your own students in future. Accept that very joyfully because you have taught those students to become like this, and it's your success that you have this opportunity to learn from your own students. Thank you very much for your extremely patient listening.